Good afternoon. I'm Joe Fenn, the Executive Director and President of the Massachusetts Housing and Shelter Alliance, and welcome to this very important discussion on unaccompanied persons experiencing homelessness in the light of the COVID-19 pandemic. We're honored to host this important discussion that over 300 people have joined us to participate today. We're soon going to meet our panelists, but before we do, I'd like to thank our friends at Rasky Partners, George Cronin, Sandy Goldfarb, Andy Hoagland, and Jessica DiMartino for making today's webinar possible. I'd like to thank all of you who are participating in the webinar, but today I'd especially like to thank some state representatives who are participating on the call. That's Representative Natalie Higgins, Representative Jim Hawkins, Representative Michelle Dubois, Representative Patrick Kearney, and Representative Tricia Farley-Bouvier. These guys, they did more than talk the talk. You guys really went above and beyond your job descriptions, and we're out in your communities ensuring that space for depopulation and quarantine were made available for persons experiencing homelessness, and all of us are grateful. And thanks also to the many legislative aides and public officials that are participating today as well. And of course, finally, I'd like to thank our panelists. Someone who's been in this area a long time, Lyndia Downie, the President and Executive Director of Pine Street Inn. She has over 35 years working at Pine Street, and since becoming the President and Executive Director in 2000, she's become one of the leading innovators in permanent supportive housing and rapid rehousing to address homelessness in Massachusetts. Lyndia presently is pioneering triage assessment and diversion strategies that move people swiftly out of shelter. John Yazwinski, I've known a very long time, President and CEO of Father Bill's MainSpring, and an innovator in housing since 1999, and a leader in establishing housing first approaches in addressing homelessness. Most recently, John's been a leading voice calling for the replacement of the traditional emergency shelter model with an innovative housing resource center model, which would direct more energy, staff, and funding towards homelessness prevention and rapid rehousing. And finally, someone I'm so happy who's here with us at MHSA, Joyce Tavon. She's our Senior Director of Policy and Programs. And Joyce brings over 30 years of experience working with nonprofits on homelessness and housing solutions, both through her consulting and her direct work for agencies in Massachusetts. She initially joined MHSA. She was actually the first employee of MHSA in 1991 as its first paid employee. But she went on from there because she was the founding director of an innovation called HomeStart, which we're all aware of in the homeless world, a housing search and stabilization organization. She's gathered extensive experience in strategy, planning, and fundraising over the years. In her second time around at MHSA, she brings a wealth of experience dealing with HUD planning processes. And finally, a good friend I've known quite a while, State Senator Paul Feeney of Sharon. Senator Feeney is somebody, in my mind, he's in his second term representing the Bristol and Norfolk State Senate District, consisting of Medfield, Walpole, Foxborough, Mansfield. It's quite a few towns, Senator. I think I'll leave it at that, but also parts of Sharon and Attleboro. Senator Feeney is again, he's never forgotten where he comes from. He worked for 20 years as a technician for a telecommunications company, and he also served as the legislative director and spokesperson for his union, a great group, the International Brotherhood of Electrical Workers, Local 2222 in Boston. And since coming to the Senate, he has become one of the real leading voices for permanent supportive housing, as well as an eloquent champion of that. Now, for those of us who spent our lives working to end homelessness, the last 4 months have been unlike anything else we've experienced in our professional lives, and has caused us to look at our Commonwealth's response to homelessness in completely new ways. The pandemic has laid bare the inadequacy of our emergency response alone, and has indicated to us what we've always strongly suspected. Homelessness is a public health issue. It is a public health issue that impacts the poorest and the most disabled among us. The reason for our webinar today is to share what our experience has been, what we have learned from it, and how we believe this can be an opportunity for real change and transformation of this system that impacts so many people. I'd now like to introduce our moderator for today's discussion. Lynn Jolicoeur is a field producer, reporter, and editor at WBUR. And I think many of us are familiar with her work at WBUR, her work on All Things Considered, and other national work on NPR. Most important to us, though, is that she has developed beats covering homelessness and mental illness. She has reported in depth on efforts to end chronic homelessness and the weaknesses in the system for sheltering and housing adults experiencing homelessness, and also more recently, the effects of the coronavirus pandemic on the homeless population. Why we chose her to moderate this panel today is because we know, as her four-part series right before the pandemic indicated, she's willing to wrestle with the complexity of the issue of homelessness and ask us the difficult questions that need to be asked. And with that, thank you very much, Lynn, and I turn it over to you.
Thank you so much, Joe, and I'm very glad to be with everybody today. Thank you so much for asking me to moderate this important event. I would like to sort of divide up the conversation into three areas. First, I'm hoping to focus on the immediate crisis at hand, what's happened in the pandemic, what shelters have experienced, what the homeless community has experienced, and what's been learned from that. And then the cry from shelter providers and homeless service providers that we never go back to overcrowded shelters again. And then finally, what steps stakeholders feel are needed to move forward long-term in terms of re-envisioning shelters and scaling up housing. So first, in terms of what has happened in this pandemic, Lyndia and John, I would like to start with you. And for those who aren't familiar, even those who are familiar, there are many lessons in this and there have been many things learned. Can we start talking about what you have experienced? John, you had very different experiences at your two shelters. One, you were able to decongregate much sooner than the other, and you saw lower rates of coronavirus spread. And then Lyndia, despite the many precautions you took, by the beginning of March, you saw a high rate of asymptomatic spread. So Lyndia, can we start with you, and can you tell us what exactly happened at Pine Street Inn?
Sure. I think, you know, we were coming off a winter, like many other winters, a mild winter, but we, you know, had been an overflow. So we probably easily had 100 additional people in all of our shelters above and beyond just the bed capacity. We were not 6 feet apart. We were not compliant in early March with the CDC guidelines. And when we started doing some testing of people who were symptomatic, we were getting a return of 1 in 6 people who were symptomatic. We worked very closely with our great partner, Healthcare for the Homeless. They came to me and said, look, this seems like a high number. We'd like to do some universal testing. We modeled out on, I think, 1 in 6. And it turned out that we came back that 1 in 3 of the people we universally tested were testing positive, and close to 40% of those folks were asymptomatic. And it meant we had to scramble to find both quarantine, isolation sites, hospital beds for people who were sick. It was really challenging and really difficult. And in the end, between the city and the state, I think probably 400 or 500 hospital type beds were brought up to help homeless people, either who were COVID positive or COVID positive and quite sick.
And so you said you weren't able to spread beds 6 feet apart initially, but you were putting curtains up between beds, plastic curtains. You were installing hand washing stations and more hand sanitizer and staggering meal times and that sort of thing. So you were taking the steps you could, and yet this did happen. I know masks were not readily available at that point. And again, this high rate of asymptomatic spread really came as a surprise to the clinicians doing the testing. And then John, you were able to spread out your population, at least for one of your shelters, sooner, and you saw very different, you had very different experiences at both of the shelters. So tell us about that.
Yeah, it's a little bit of tale of two cities, you know, and everybody tried so hard. We knew early on in March that our population was such an at-risk group, so many elderly people in our shelters, so many people with compromised immune systems. And so probably early to mid-March, we went right to our municipal leaders into the state and said, we need help, we need to depopulate. And thankfully in the city of Quincy, we were able to depopulate. We were able to move into the South Shore Wise Field House, and we really targeted our, our most compromised and at-risk group. We were able to move also on a local motel with the help of the city in Quincy. And we've tested all the guests at Father Bill's place in Quincy 3 times now. We've had about a 6% infection rate by separating, having 3 locations that our Father Bill's place usually sheltered around 137 people a night, people sleeping on the floors, and separating everybody and having only 40 or 50 people and meeting the social distances. In Brockton, the whole community, the mayor, the delegation, everybody tried to help us to find a place. But we did face some NIMBYism in that. We faced some tough times to find a building. And so not until early April, we brought in the MEMA tents, and we thank the state for stepping up and helping out. But bringing in the tents a few weeks too late, we ended up having a 32% infection rate. So it's been hard. It's been managed now. Testing has been the key. We've tested over 4 times all the people down in Brockton also. And it was a little slow getting people into the isolation centers, but once it got up and running, we've been able to see a lot of people return healthy.
And then what is your plan, because you can't stay in those facilities forever, the Y, I believe you're losing at the end of the month. Lyndia, you have people in a Suffolk University dorm, which will eventually go back to being a dorm. I think last I heard you have that space available until sometime in August. What is going to happen in the near to medium term? Because as you've said many times, both of you, we can't just send everyone back to the shelters, and the coronavirus is going to be with us for some time. So dealing with just the time frame we're talking about while we're dealing with COVID-19, what is your plan? Is there a plan?
So we had a similar experience to what John had. We were really fortunate that Mayor Walsh was able to secure the Suffolk University dorm and another site on Commonwealth Ave. So we and the city shelter together split those spaces up, and we were able to depopulate very quickly. When we started testing initially, we had a positive rate of about 34%. When we tested after decrowding, we came back at 4%. So I think there is absolutely no question that the decrowding had a major impact on the infection rate. Obviously, certainly the personal protective equipment played a role. We're now really talking to both the city and the state about how do we get bridge facilities, possibly for the short term, so that we can keep the decrowding and shelters going. We cannot go back to 100 people over our capacity every winter. It's just going to reinfect the entire population, put a tremendous strain on the healthcare system, and be devastating for the men and women that we serve. So we are talking to the state about how do we think about additional sites for at least a year. Could some of these sites be converted to permanent supportive housing? I think so. If the right pieces line up, we could certainly do that. But we need to move from being incrementalists on supportive housing to it being now and finding facilities that can be quickly converted.
And I know we're going to get a lot more into that in the conversation. John, if you can just address what your plans are here in the near to medium term.
It's happening this week even. So we're moving out of the tents this week in Brockton, and we've secured a motel for 67 people. So that's going to allow us to stay depopulated. And our organization's commitment is let's try to stay as depopulated as long as possible. We don't want to have people come back into our crowded buildings again. And right now in Quincy, we're planning to move out. We're losing the Y Field House next week. And with the city of Quincy's support, we're moving over to hotel rooms at the same time. And we're taking it month to month at this point. Really, we're working, hoping that with FEMA support, with the state support, we can figure out how to pay us. And we're going to our private supporters. We're about saving lives right now. Day to day. We don't want to see a lot of people outside on our streets in our community. And definitely during a pandemic where then it could really turn into a public health crisis.
Right, and I do want to make the point that even though there's been this high rate of asymptomatic spread, a majority of people have had no symptoms or very mild symptoms when they test positive. Some do go on to develop symptoms, most of them mild. A small percentage has been hospitalized, and there have been some deaths. So we have to make the point that, some people might hear this and think, oh, it's not that serious. It's asymptomatic and people are just developing mild symptoms and then they're okay. That's not the case for everybody. And there certainly are people who will be at more risk and are more vulnerable. In Boston, I know Boston Healthcare for the Homeless told me they know of 10 or 12 deaths. It's 12, but a couple of those people had actually been living in nursing homes. So it was probably more of a result of the fact that they had been living in nursing homes more recently, but about 10 people who were in the shelter community in Boston. So certainly there is a risk. It's a public health crisis. You can't get around that at all. Joyce, what are you hearing from providers? First of all, I'd like to ask, Lyndia and John have had some success, obviously, in depopulating their shelters, but is that the case around the state? Have all shelters been able to do that?
Well, it's really varied from community to community. From the surveys we've done, we've looked at roughly about 3,000 of the emergency shelter beds across the state where there really is the greatest risk because of how concentrated people are. And if you were to depopulate, you really have to look at cutting that in half. It has not happened consistently. What we would say, we have some real opportunities here. As a state, we've secured FEMA approval to open what are called non-congregate shelters. So essentially you could take a motel. We have the approval to move medically vulnerable people in. It's been used a little. We would strongly encourage taking maximum opportunity of that approval, as has been done, let's say, in a place like California, where they've moved 15,000 people from streets and shelters into motels. You could do motels, distressed rest homes, other kinds of places that get people kind of into a room for themselves. That's much safer.
And, John, I know you and Lyndia have discussed these things and are now pushing ideas like this, the idea of acquiring former hotels, properties like that could be converted quickly. Can you talk a little bit about that briefly, and what stands in your way? What are the barriers, the regulations, the funding issues?
So I mean, for Father Bill's and MainSpring, absolutely right. We need to reinvent the housing opportunities right now, and we need it to happen quickly. So we've looked at motels and hotels that maybe there'll be a few in this, tough time that really could be converted. You add a kitchenette to a room, and we've got really a nice efficiency apartment for people experiencing this issue. So we're right now aggressively chatting with owners of motels and saying, hey, would you consider depopulation? But at the same time, can we talk about possible shifting it and acquiring it? Really what we need is from the state to say, hey, let's look at changing how we develop permanent supportive housing, that does take several years to say, can we get access to capital and can we get access to operating subsidies to be able to move on this quickly, so that in a year from now, we're not seeing us turning away a lot of people or people sleeping outside. So we're being very aggressive at least shopping and having conversations. We're moving into the motels now to depopulate, but long-term, we want an exit strategy just like the state does. This would be a great exit strategy, is to look at properties in the community that we could all agree on would be a great option.
Senator Feeney, I know you've been a big advocate of permanent supportive housing, and you've championed that in the legislature in terms of funding for that. So I want to talk a little bit later on about the long-term picture, but right now we're dealing with this crisis at hand, and this cry from shelter providers that we can't go back to the situation of overcrowded shelters. It's a safety issue, it's a public health issue, and as they've been saying for a long time, no one should have to live like this to begin with. I know that's been the call for and the cry for a long time, that we shouldn't be warehousing people like this. So do you feel a sense of urgency? Is there a sense of urgency among lawmakers, among state officials, to use this time as a turning point and really bring about systemic change?
Yeah, first of all, thank you, Lynn and Mahasa for hosting this. I mean, it's been a great discussion so far, and we've seen, really from the folks that are doing this work on a daily basis, not only the challenges that they've been facing for so long, but really the things that have come to light through COVID-19 and this pandemic. They should really be no surprise to many of us, right? I mean, these are issues that we've been facing for a long time in the Commonwealth. Now that we are dealing with a pandemic and kind of an emergency situation, we're starting to, understand that, yes, we need to triage, what's happening now and to make sure that we're keeping people safe. And as John said, we're saving lives. But really to use this as, not a learning experience, which sounds so cliche, but really to debrief, like we're doing today, and to be able to advocate through, with my colleagues to say, look, this is something that we don't have to face. Now, right now we're dealing with a novel coronavirus as the pandemic, but you know what? Substance abuse is a pandemic as well. Mental health is a problem across the state. And, this is one that's kind of rising to a level of, saving lives immediately today. And that's what's right in front of us. But as we have these conversations, it's helpful for legislators like me to really understand that, this is highlighted some systemic issues that we need to address going forward. And we should absolutely learn the lessons of what we're dealing with now to change the paradigm going forward so that, we're not in this situation again, whether it's, a coronavirus or, like I said, mental health, substance abuse, and so many other things that are affecting our homeless population, especially the chronically homeless individuals that are really, in jeopardy, not only with this virus, but in so many other mental and physical health issues. So this is a great discussion because it really does highlight the importance, from a legislative standpoint, to have a long-term vision, but to have immediate action. And I hope that this discussion and the discussions we've been having with, providers throughout the Commonwealth in the last couple of months really, spur us to action going forward to address these issues. We have a couple of months left in session for our legislative session this year, and I think it's urgent that we act now.
In terms of people who are experiencing and dealing with mental illness, substance use disorder, I've heard many times from providers, including Lyndia and John, that we need wholesale change in terms of people being discharged from systems of care into homeless shelters, into homelessness. And certainly this crisis is just highlighting that as well. So Senator Feeney, what sense of urgency is there on that? I know that when I did that series that Joe mentioned at the beginning, that aired at the beginning of February, the state, Lynn Tordo with the Interagency Council, told me that the state was working on sort of rewriting protocols for discharge from hospitals, from treatment centers, that sort of thing. So I guess I'll ask all of you, do you see change on that front? Because that is a big factor in the crowding issue in shelters, people being discharged with no real discharge plan in place. Senator Feeney, I don't know if you want to talk first, and then Lyndia and John.
Yeah, briefly, I'd love to hear from John and Lyndia from their experience. I mean, look, one of the issues that we have, I think, across the board in the Commonwealth, especially when you talk about issues surrounding homelessness or even healthcare in general, and any human services, is that continuity of care, right? A lot of the things that we do are kind of in silos, and we move people from one place to another without that continuity of care. And, when you have a pandemic like this, it really does highlight the need to be able to kind of have those warm transfers and to have, an understanding of where, folks are going next, what the short-term plan is and long-term plan is. So, it's certainly a conversation that we've had with the Baker administration and with the task force and Secretary Sutters as it relates to COVID-19 and what those handoffs are going to look like as people progress through, certain places and programs. But for, on a long-term basis, I think it's something that we need to address. Right now, the problem in front of us is urgent. And, I know that we're having these discussions, but I'd be interested to hear from John and Lyndia from, their perspective, what it looks like when they are receiving people and people are going from place to place.
Right, Lyndia and John, if you can tell us a little bit more about what you see people experiencing along those lines, and then Joyce, also what you're hearing and seeing from the state in terms of what's come out of these recent conversations, listening sessions that were had with providers, and specifically on that front first in terms of changing these discharge protocols, trying to reduce the number of people or eliminate this, get rid of this idea of people being discharged into homelessness with no other plan in place. So Lyndia and John, if you can go first.
Yeah, I mean, I think, to echo a bit what the senator said, shelters have become the answer to a whole array of different problems, but not the right solution to all these problems, right? Why don't we have a mental health system where there's low barrier access for people, low barrier housing for people who are mentally ill? Pine Street now runs more housing units than shelter beds. Last year, our retention rate in our housing was 96%. And in that housing is people who were formerly homeless, some of whom are mentally ill, some of whom are poor, some of whom have medical issues, some of whom have substance abuse. And we know we can do a better job for people and not have this siloed approach if we build the right kind of housing, and that housing is easy for people to access. One of the first calls we got during this pandemic was from a hospital in Western Massachusetts, 2 hours away from Boston, trying to release someone who was homeless, who had tested positive for COVID. And when our staff said to the person on the phone, why would you send the person to Boston when their friends, family support system is in Western Mass? And they said, well, we couldn't find a shelter in Western Mass, so we thought we'd send the person to Boston. That's not a solution for someone. The solution is to problem solve locally for people as much as we can. But ultimately, this comes down to the fact that we don't have enough low barrier capacity for people who struggle with what the senator pointed out. And that's where we need to get to.
John?
Yeah, I think one of the things that this has highlighted, this pandemic, is just how much of the shelters has been a safety net for the last 30 years. And now when the systems have just state systems or medical systems, private mental health hospitals have just gotten used to dropping people off at our shelters. And since we depopulated and we're following the CDC guidelines, we haven't been able to take new intakes. And with that, people are angry. I mean, people from different systems are calling and saying, to the state and saying, you need to tell Father Bills to take this person. And they're yelling at our staff. I mean, it's just brought systems that are used to working together. And people are saying, why aren't you taking the people? And I'm saying on a non-pandemic day, you shouldn't be discharging to us. And now we're in the middle of this crisis and you're getting angry at a system that is just trying to save people's lives. So it's really brought a lot of tension, but it's brought it to light how the shelters have really been covering up on a lot of inappropriate discharges through the past 30 years.
Joyce, I have heard, I was just going to say that there have been some improvements made. For example, the Department of Correction, I was told, has made some improvements in recent time in terms of discharges. Well, what are you seeing on that front?
Yeah, so it's interesting. There's been this whole movement during this pandemic towards decarceration, which makes a lot of sense. That's another site where people are at high risk, and certainly we can support that. However, what we started to see is we were getting all these calls and inquiries of people planning to, send people from jails and prisons to what? To homelessness. And we found we really had to push back on that. Yes, definitely our state systems are starting to step up, but I think it's a bit of a scramble because we've had decades of this, of just not having an adequate system for state systems of care and people being discharged to shelters and homelessness. So I think we're seeing some steps from corrections and from the jails. We hope to see more of that from the other systems of care. But all of these systems are feeling the shock now that they can't simply discharge to shelters.
John, I did just want to come back because you mentioned not being able to take new people. I know you and Lyndia have been in that position now for a while since you decongregated, and you basically have your population that has been tested, and then you have more testing, and if people safe and healthy as possible for the people in the shelters. So you're now in this position of having to turn people away, which you do not normally find yourself in. So I know, Lyndia, you told me early on that you were doing everything, your staff was doing everything to try and help people find other placements to not have to go into a shelter. I know the Boston Public Health Commission shelters, Southampton Street and Woods Mullen in Boston, have continued taking new people. So is that pretty much the only option in the region right now for people if they really have no other place to go in terms of getting into a shelter?
Yes, at the moment. And I think we in public health are struggling between social distancing, trying to save people's lives, not putting people at risk, and not at the same time trying to make sure the street numbers don't go up. And we're not going to solve all these problems without additional capacity and additional housing. And the front door, there's no question we can do more at the front door to problem solve for people. And we've, paid for hotels for people for a week or two. We've transported people back to friends or family and said, look, can you wait this out a little bit and then we'll help you with housing. But even with that number is never going to be 100%. We're not going to be able to stop homelessness for 100% of the people who show up at any of our front doors. So we do need to be working both at the front door and then really trying to figure out how we find more capacity, especially on the housing side.
I'm thinking about how in February we talked about your desire to see sort of a re-envisioned shelter system, that obviously the ultimate goal is to move away from shelter and have more permanent supportive housing. And I know that your desire, John and Lyndia, among other advocates, is to have, and Joe and Joyce, is to have a system where there are more entry points around the state. So people aren't having to leave their area and come to places like Boston and Quincy and Brockton from outside the area where they became homeless and find services there, be able to enter a shelter and very quickly get triaged, have their needs assessed, and be quickly put on a path to housing. So it's striking that conversation was really happening sort of at a fever pitch statewide just a few months ago, and then this pandemic hit. So now it's sort of taking that vision of what you were hoping and increasing the urgency, I guess, but where you have this element thrown in of having to decongregate, depopulate your shelters right now and for an extended period. So what, I guess I'd like to hear what your vision is now in terms of taking all that together. What is the role of the shelter system? What is that role that you want that to play? And then in terms of what you want for permanent supportive housing, and we'll get more into that, the permanent supportive housing piece and what is lacking. But I guess right now, in terms of envisioning the shelter system, what do you want it to be or think it should be? John, if you want to go first.
If we look at the next 12 months, the front door, we have to redo the front door where, about 20 or 30% is probably a little low. 20 or 30% of the population are coming from other state systems. That just needs to end. We cannot deal with depopulation. So we need 20 or 30% that usually end up in our system, in our shelters. We need help from the state to say, okay, alternatives have to be made. We're not putting that stress on the shelters. The other piece is we have to rethink of the front door where we have to test everybody now. We should not be putting people into our buildings, walking up into field houses or gyms or our shelters without them being tested and knowing. So that's one of the reasons why we have been a proponent of motels. It's a good quarantine site. So we have to think about the portfolio, and every community is not going to be able to afford. We're never going to be able to afford the motels in the long run, but we need to have the quarantine sites right there. And that's why we need the rapid rehousing immediately to move people on as quick as we can. And we've got to start thinking of, we're going to try to think about the next couple of weeks. How do we reopen, right? How do we reopen? And having the healthcare centers, which have been huge for us, they have, the one good thing we've seen is the healthcare providers have really stepped up to really fill a gap for us. It's been tremendous. And they've got to stick with us for the long term. But for the next year, that front door has to change. And those are some of the areas we could focus on.
Lyndia, and what about not just the next year, but beyond that? How you are envisioning, how you would like to see shelter be, the role that shelter will play. And so I guess from what you've all been saying, you're envisioning shelters. What you would like to see is shelters that are non-congregate settings. and very quickly move to that kind of model? And then what role do you want those to play in terms of people being able to quickly come in, I guess, and not sort of get entrenched in the system, but be able to move out quickly?
I mean, I think the next year, Lynn, will be a time of transition, as John said. And so one of the things that we're envisioning is if we can find some sites, some hospitals, some closed nursing homes, you know, you place people in there who are at risk for now, and then you try and find them housing. And you take a year and a half to house them, and then gradually convert some of those sites, if it's appropriate, the way John's talking about, to permanent housing. We could put a kitchen in these things for short money, turn it into a small studio apartment. You move your chronically homeless folks in who are homeless the longest, and that frees up some capacity in shelter. You know, Pine Street's done this before. It took us about 3 years, but we closed 30% of our shelter beds as we added more and more housing. We took our chronic people out, put them into housing. That freed up a lot of capacity in shelter, and it allowed us to actually take down shelter beds. It was very intentional and planned. We don't have time for that now. We have to now figure out what sites can we find quickly? How do we convert them quickly? How do we create a supportive housing infrastructure at the state side? And we need EOHHS and DHCD to work together, and Mass Health. Those are the 3 agencies at the state that can make this happen. They can do it. We've done it at Pine Street. I know it can be done. We've got to do it now faster and cheaper than we've done it in the past.
Lynn, can I just add one quick thing? Is Father Bill's in MainSpring, part of our strategic plan is to convert our shelters to resource centers. And I think for long term, it's like a medical emergency room, right? We want people to be prevented, diverted, and then rapidly rehoused and really, you know, have it be kind of a one-stop shop. And so that's what we're hoping for the future. For the long term, I guess, it's just to convert that, you know, that mentality of really focusing on outcomes.
And you have said in the past you want to see, you envision it more as something like a triage rate instead of a bed rate, what you're getting from the state, where it covers all of these services you're offering. I know you've said that the state pays less than half of basically what you're providing, the services that you're providing. And I know the state did tell me that the reimbursement tends to be about 40 to 60% of what providers are spending to take care of the population. Senator Feeney and Joyce, I guess I would like to hear from you in terms of what you think is missing. What, you know, even if that happens where the shelters can and homeless service providers can get the funding necessary to triage people quickly, assess their needs, move them on a track to housing quickly, the housing has to exist. And everybody knows there's nowhere near enough affordable housing in the state. So what is missing? Where has the state fallen down in that regard?
Well, I would say, you know, we've got some great leadership. What we're looking for is the partnership from our state with us and really being as strategic as possible with the resources coming in. I mean, right now during this crisis, we really have an opportunity like we've never seen before. Our state is receiving $2.4 billion in coronavirus relief dollars. In emergency solutions grants, collectively as a state, we're getting $104 million. That's about 12 times what we normally get. Just starting to look at these dollars in a strategic way and taking a small amount. For example, I cited California before. They're proposing, the governor there has proposed $600 million so that people who've been sheltered temporarily, motels, can be moved directly into permanent supportive housing. Either purchase of those motels, you know, and turn those into the housing, or other pathways to housing. So we have opportunities, and if we partner, now is the time. If we can set a number, we've done the research. We know if we can get between 600 to 1,000 units on board in supportive housing, targeting the chronically homeless individuals, we can make a huge dent in the capacity that we would need in shelter. So let's seize this opportunity. We're not going to have something like this again. And by the way, that $2.4 billion, it's got to get spent by December 31st. So we really have to move now on this opportunity.
I just want to say one thing. When I said, where is the state falling down? I meant if the state has fallen down, and I don't just mean the government leaders, I mean the community as a whole, the state, Massachusetts.
Yeah, and certainly, and again, we've got some dedicated, strong leaders. It's a matter of partnership, and I mean that across the administration. As Lyndia said, it's EOHHS, DHCD, Mass Health, all working together. It's our state administration working with our localities, because some of these funds are coming directly to the state, others to communities, and our administration and our legislature, all of us partnering together to maximize these resources and this opportunity.
Senator Feeney, would you like to add to that?
Yeah, thank you, Lynn. I mean, look, we just heard how important this is and how the front end is set up, right? Folks like John and Lyndia and Pine Street and Father Bill's, they're doing that work to be able to make that transition. Everybody, I think there's consensus built around many of the organizations that we're talking about today that this is where we need to get to. The missing piece, which you aptly said, what is missing, is the housing on the back end. There has to be a concerted effort for all of us to come together, just as Joyce was just saying, for all of us to come together with the single plan and to move away from what we've done for so many years in the legislature and the administration, which has been, to kind of spread it around a little and take care of this here and this over here and this over here. It's a model that is important as legislators when we're looking back on the home front in our own districts and some of the unique needs that, that we're facing in different cities and towns. But really, it's done nothing to create a comprehensive, one-track focus for what we're going to do to end homelessness in the state and chronic homelessness, which is to put people in homes. So really, we need to shift, kind of this discussion about, what we're going to do on the front end, which I believe there's a lot of work going on there. Really to, okay, what does it look like at the end of the day? And at the end of the day, if we're going to put people into homes, then the state needs to invest to make sure that we have the resources for those homes. The system itself right now is a system of, like you said, it's triage, right? We run a system where we're trying day to day to keep up with the needs of our communities and the folks that we need to try and make sure that they're in shelters and that they're safe and that they're healthy. But we're really kind of missing the boat on a larger scale discussion with the legislature and the state to say, yeah, that's great, but we're simply putting Band-Aids on problems where we could actually go and fix long-term. If we invest, if we use our budget, we always talk about a budget being our statement of our values as a legislature. Well, if we want to eradicate homelessness, if we really want to make sure that we're taking care of chronically homeless individuals and families, then we will invest in homes. We will invest in permanent supportive housing that is low threshold, right? So that you don't have these circuit breakers that, that chronically homeless individuals must trip before they can have access to that housing. A lot of the same kind of factors that led them to homelessness to begin with become difficulties and challenges in getting them housing, right? And that's crazy to me that as a legislature and as a state, we don't recognize that and say, okay, let's stop. I understand to legislate, across the country, it's like turning a cruise ship and it happens slowly. But we don't have that type of time. We have an opportunity now to really, come together, to work with folks like Lyndia and John and the folks at MHSA and say, okay, the plan is there. Now as a legislature, we are going to devote resources to it. We're going to increase the amount of permanent supportive housing across the state. We're going to identify it. Let's work together to do that. Let's look at, places like closed down nursing homes, as Lyndia said. Let's look at hospitals. Let's look at places that it really won't take a lot of resources. And instead of spending money on every other line item that has to do with homelessness, like emergency room visits, like ambulance rides, like detox centers and beds, instead of simply saying, well, we're going to continue to increase funding so that folks that are homeless can go and find a bed for the night or for the week. Instead of doing that, why don't we really come together and say, well, let's increase the amount of permanent supportive housing in the state with that same money so that they can actually be taken care of for a lifetime. So, that's the missing piece. And I know that momentum is happening now and those conversations are happening. And I'm incredibly optimistic after talking with so many of my colleagues that get it. But it really is, it's a Herculean effort when you talk about, shifting the entire conversation from something that we've been doing for so many decades here in Massachusetts, and being more proactive and kind of having this long-term strategy with immediate action. But, you know, I'm confident we can get there. It's just, my God, we're running out of time, and we have the opportunity now to do this.
I know we've all heard, and many or most people listening to this session have heard the expression housing is healthcare. And in a conversation I had recently with Lila Bernstein from the city of Boston, the deputy director of the supportive housing division for the city, she's the advisor to the mayor for the initiative to end chronic homelessness. She said, and I know she has said before, this is the responsibility of all systems that care for vulnerable populations to develop housing. So not just to care for these people and to make sure they're not discharged into homelessness, but to be part of the development of permanent supportive housing. There has been movement on this. I know there has been some movement in Massachusetts and other parts of the country. You see some health insurers, I believe it was United Healthcare, developing permanent supportive housing in another part of the country. So are those conversations happening, and is it moving beyond conversations to be getting Massachusetts hospital systems, healthcare systems, and other systems that care for vulnerable populations that are not currently developing housing to be in taking part in that, the development of permanent housing? I'll throw this out to anybody.
Yeah, I just quickly, from my perspective, you know, when I got sworn into the Senate, one of the first meetings that I had and sat down with was Joe Finn. And Joe clearly articulated the need for this and said, you know, Senator, we have so many great champions in the legislature with people that are, you know, that recognize the need for this and that have been active. But we really need somebody who's going to kind of move the ball downfield and get action. And I think it was kind of just a confluence of events where, you know, we had some money and some resources in the state budget that we could spend and start to shift. So we started to do that. Two sessions ago, we introduced an amendment on this. Last year, we were actually successful on it, where the state Senate and the House eventually came together and said, yep, you know, we should start spending some more additional resources on this. And for us, from a strategic standpoint, it was okay, let's get the ball moving a little bit. And then ultimately kind of build up to, you know, where it's critical mass, where we have so many folks that say, yeah, this is working. You know, let's look at Worcester, for instance. Let's look at other places. Where have we been successful in, you know, in increasing permanent supportive housing in the Commonwealth? Let's look at the success stories, and then let's have that motivate us towards further action. So from the conversations that I've had, and I know leadership certainly in the Senate has been very vocal and supportive of this. We just have to get to a point where this is on the consciousness of all of us in state government, so that, you know, we can say, yep, the plan is there. Now let's just invest in it. The unfortunate part, and you know, we've seen so many difficulties and challenges with COVID-19, is that the state budget next year, we're looking at probably between a $6 and an $8 billion shortfall in FY21. When I look at the folks that are on this panel today and think about the organizations that rely on so many of these line items, there is going to be a lot of economic pain in the next year. But it's important, again, just like I said a few minutes ago, for us to understand that there are savings here as well. There are savings here. When you talk about, you know, healthcare in homelessness, there are savings that we can achieve. So let's be smart about this. Let's not just cut budgets for the sake of cutting budgets because, you know, we have a shortfall. Let's be smart about it. Let's spend the money in a smarter way. When you talk about permanent supportive housing, I think that's the smarter way. And my conversations, certainly with my colleagues and, you know, with others around the state, is that they agree with that and they understand that.
Joyce, Lyndia, and John, we have minutes before I want to come back to Joe for a final question, actually, before he wraps things up. But can you touch on that in terms of other systems of care getting involved in development of housing and what you see on that front in terms of movement and change?
I guess, you know, I think what I'd say, Lynn, is that certainly health insurers have a vested interest in this because we think we can save the money. We think we could save the correction system money, frankly, if, you know, there was housing for people leaving or some kind of transition for people leaving corrections. So I think on the healthcare side, though, there is no question that it has been proven multiple times by Mass Housing and Shelter Alliance. We did a study a few years ago with Blue Cross Blue Shield. There's probably 50 or 60 national studies now saying permanent supportive housing saves money on healthcare and saves money on lots of other systems. So it's a matter of redirecting that money to the solution instead of the Band-Aid. I'm not convinced that every hospital, for example, in Boston needs to be building housing. We'll build the housing. We know how to do it. We want to do it. We want to partner with them. We need help on the operational side. We need help on the support side. Could they provide direct support? In some cases, could they fund direct support? They need the flexibility to be able to do it as well through Mass Health or federal healthcare dollars. But this is something that's been studied over and over. We now need to get to how do we execute on it.
Yeah, we're excited about some steps with some of the Accountable Care Act organizations that have started to invest in our triage and assessment, rapid rehousing models. And so we're excited over the next year to see if we can start to get some of these groups to really see the value in it. And again, saying we need help on some respite programs for really expensive, medically compromised homeless people that don't have a home and stuff. So I'm excited about the future in this way.
Joyce?
Oh, go ahead.
I'm sorry.
I would add as another point, I keep thinking from some of the HUD office hours listened to and the encouragement they're giving us during this crisis to, again, be as strategic with these dollars as possible. And the quote I kept hearing was, short-term investments have long-term consequences. Mm-hmm. And for those of us who've been in this field a long time and entered it well-meaning with the opening of shelters decades ago, never did we think that 30 years later, after putting money into shelter, we would have shelter, right? So now is this opportunity. If the danger is, if we react in this crisis and simply bring on a lot more shelter, we're going to have shelter. So now is the time, the short-term investment, as I said, there are some federal dollars like we've never seen before. We're starting to build those partnerships with the hospital systems. Let's invest in supportive housing. And we've got some pathways to get going literally in the next few months. And let's take that opportunity so we can start to dramatically reduce the shelter system.
If I could add, I know I'm at host, Lynn, but I really want to point out one of the really successful partnerships that existed was United Health Foundation actually contributed about $1.4 million into a program which we finished up over a 5-year period, and Mass Health has gratefully continued. But essentially what it was doing was targeting with our partner, the managed care organization, the Massachusetts Behavioral Health Partnership, was basically targeting people with psychiatric hospitalizations, long-term homelessness, and focusing them on housing. And one of the things that we found over that period of time was that housing, again, to go back to what Lyndia was saying, seems so obvious to us at this point, but it dramatically reduced hospital readmissions. So we know housing is incredibly effective. And of course, I think that's been stressed here today. So. And
one model that you at MHSA have been encouraging communities to consider is the modular construction idea. And Worcester Housing Authority just learned that it was approved for the first in the state development of a modular building with micro units of permanent supportive housing to house people who've been chronically homeless. So they've worked with you on that, and they got the green light from the state and about $2.2 million in funding of what the price tag they're estimating to be $3 million. So they're going to be moving quickly on that. They say they're moving at lightning speed, hoping to get it constructed and up, maybe even in time to house people, about 24 people in time, and one residential manager living in the 25th unit. But in time, when the coronavirus is still a threat, maybe having the building up even by early next year. So it seems, just from an outsider, a non-expert like me, to be just so obvious and easy solution. It's much cheaper to build, about half the cost of traditional construction, you've said. So is this idea catching on? Obviously, you still have to have land, which is harder to come by in a place like Boston. And this is land that the Worcester Housing Authority already had. But Joe, do you see that idea catching on?
Well, I think, again, Lynn, the issue that existed before the pandemic was we had to find less costly ways of trying to bring housing to scale. And I think that's what the place to live kind of concept was all about. And God bless the Alex Corrales, the president and CEO of the Worcester Housing Authority, because it really represents, even aside from the housing model, it represents an engagement of a local housing authority taking on responsibility for the population that we've been describing, long-term chronic homeless individuals, and providing a low threshold setting where he's working in partnership with other agencies in that area to provide the necessary permanent supportive services. I think it really represents that type of cooperation that's necessary. And if we can, if this model works, which we're hoping is a cost-effective model or a way of just developing additional capacity, then, we're going to just continue to push, obviously, with housing agencies and providers and everyone across the state to consider that as a model.
Well, thank you, Joe, and thank you to the rest of the panelists. Thank you for having me as moderator. It's certainly a valuable conversation that we could continue on for another hour easily, I'm sure, but we're going to wrap up in a few minutes, so I'm going to hand it back to Joe for some final thoughts.
Again, thank you, Lynn, and I can't speak about my colleagues, but I just have to say that this session just really blew me away in terms of understanding, again, what a point we are at in terms of the possibility of transforming a system. So again, I want to thank the panelists and everyone for joining this important discussion today, and that we hope to have many more such discussions all around the Commonwealth. But I hope all of you who are listening today, whether you're on the public side or whether you're a nonprofit out there struggling with the issue of homelessness in your community, I hope you'll join us in this idea of trying to address such the broken systems, the lack of appropriate housing, and all those issues so that emergency shelter won't be the default response for every problem that we have, and that perhaps, just maybe, we'll be able to end homelessness once and for all. So again, thank you all very much.